I'm going to be demonstrating an exercise called running the meridians, where I trace the acupuncture channels on the body. I'll be tracing the superficial pathways of the primary channels as they pass across the body. Of course, what I can't demonstrate is whether they penetrate deep and go to the organs. There are 12 primary channels, and these are organised into 3 sets of 4 channels, each known as a circuit. Each circuit starts in the torso, extends to the upper limb, goes to the head, descends to the foot, and then returns to the torso in order to travel on to the next circuit. First circuit. The lung channel starts 1 sun inferior to the hollow of the deltopectoral triangle. It rises through the centre of the hollow of the deltopectoral triangle, descends the lateral border of biceps brachii, crosses the transverse cubital crease lateral to the tendon of biceps brachii, descends the forearm, moving slightly laterally for lung 7, crosses the wrist joint close to the radial artery, crosses the thenar eminence to terminate on the radial aspect of the thumb. The large intestine channel starts on the radial aspect of the index finger. It ascends the radial aspect of the finger and hand, crosses through the anatomical snuff box, ascends the lateral aspect of the radius, crosses the lateral end of the transverse cubital crease, ascends the lateral aspect of the arm, crosses the anterolateral aspect of the shoulder, crosses the sternocleidomastoid, comes onto the face below the mouth to connect with the renmi, circles round the mouth to connect with the dumai, and then crosses over to the other side to end in the nasolabial groove. The lung channel starts 1 sun inferior to the hollow of the deltopectoral triangle. It ascends through the deltopectoral triangle, descends the lateral border of biceps brachii, crosses the transverse cubital crease lateral to the tendon of biceps brachii, descends the forearm, deviating slightly at lung 7, passes through the wrist joint close to the radial artery, crosses the thenar eminence, and terminates at the radial nail point of the thumb. The large intestine channel starts at the radial aspect of the index finger. It ascends the radial aspect of the hand, passes through the anatomical snuff box, ascends the lateral edge of the radius, crosses the lateral end of the transverse cubital crease, ascends the lateral aspect of the arm, crosses the anterolateral aspect of the shoulder, crosses the sternocleidomastoid and comes below the mouth to meet with the renmi, circles the mouth to meet with the dumai underneath the nose, and travels over to the nasolabial groove on the other side of the face. From here, the channel ascends to the infraorbital margin for the start of the stomach channel. The stomach channel descends inferior to the pupil that looks directly forwards. It comes to the centre below the nose. It crosses round the mouth to connect with the renmi below the mouth. It circles the jawline, passing anterior to the ear and coming up to the corner of the head, the stomach 8. A pathway separates the stomach 5, descends the thyroid cartilage, moves laterally to the midpoint of the clavicle, descends a 4 sun lateral to the anterior midline, which is the mid-mammillary line, through the nipple, down the ribs. On the abdomen, it moves to 2 sun lateral to the anterior midline. From here, it descends all the way down to the pubic bone, where it moves out to the anterolateral aspect of the legs and descends all the way down across the anterior aspect of the ankle to terminate at the lateral aspect of the second toe. A deep pathway is connected with the spleen channel, which starts on the medial aspect of the big toe. The spleen channel ascends the medial aspect of the foot and leg, comes up the lateral border of rectus abdominis, comes all the way up through to connect with lung 1, and then descends laterally to the 7th intercostal space below the apex of the axilla, or the armpit. Second circuit. From the end of the spleen channel, we go up to the apex of the axilla, or the deepest part of the armpit for heart 1. The heart channel descends the medial border of biceps brachii, crosses the medial aspect of the transverse cubital crease, descends the arm and passes lateral to the pisiform bone, crosses the palm and terminates at the radial aspect of the little finger. Small intestine channel starts on the ulnar aspect of the little finger, ascends the ulnar aspect of the hand and arm, crosses the back of the shoulder, sweeps across the scapula, comes forward to pass in between the sternocleidomastoid and the angle of the mandible, comes onto the face below the zygomatic arch, directly inferior to the outer canthus, and zigzags back to the ear. Heart. The heart starts at the apex of the axilla, comes down the medial border of biceps brachii, passes the medial end of the transverse cubital crease, descends the arm passing lateral to the pisiform bone at the wrist, crosses the palm, and terminates at the radial aspect of the little finger. The small intestine channel starts at the ulnar aspect of the little finger. It passes up the ulnar aspect of the hand and the arm, comes up the back of the arm, back of the shoulder, sweeps across the scapula, passes in between the sternocleidomastoid and the angle of the mandible, comes onto the face, below the zygomatic arch, directly inferior to the outer canthus, and zigzags back to the ear. There is a deep pathway that connects with the bladder channel, which starts just medial and superior to the inner canthus. The bladder channel runs over the head, down the nape of the neck, passing through Do14 at the base of C7. Two lines run down either side of the back. It passes through the sacrum, passes down posterior midline of the leg, passes through the middle of the popliteal crease, passes posterior and inferior to the lateral malleolus to terminate at the little toe. From here, the channel goes underneath the foot for the kidney channel. The kidney channel rises the most medial aspect of the foot, does a small circuit behind the medial malleolus, ascends the most medial aspect of leg and thigh, ascends the abdomen at half a sun lateral to the anterior midline until it gets to the rib cage, where it then moves 2 sun lateral and ascends all the way up to the base of the clavicle. Third circuit. From the kidney channel there's a pathway that connects with the pericardium channel. Pericardium channel comes to the surface 1 sun lateral to the nipple in a male in the 4th intercostal space. The pericardium channel then descends through the 2 heads of biceps brachii, descends the median foreline of the arm, crosses Laogun on the palm to terminate at the tip of the middle finger. The Sanjiao channel starts on the radial aspect of the 4th finger. It ascends between the 4th and 5th metacarpals, ascends the dorsal aspect of the lower and upper arms, crosses the posterolateral aspect of the shoulder, crosses the trapezius, comes up the back of the sternocleidomastoid, pads around behind the ears, and terminates at the lateral aspect of the eyebrow. The pericardium channel starts 1 sun lateral to the nipple in a male in the 4th intercostal space. The pericardium channel descends between the 2 heads of biceps brachii, comes down the median forearm line, crosses the palm at Laogun, and terminates at the tip of the middle finger. The Sanjiao channel starts on the ulnar aspect of the 4th finger. The channel ascends between the 4th and 5th metacarpals, ascends the dorsum of the lower and upper arm, passes through the posterolateral aspect of the shoulder, crosses the trapezius, comes up the back of the sternocleidomastoid, pads around behind the ear, and ends at the lateral end of the eyebrow. It connects with the gallbladder channel, which starts lateral to the outer canthus of the eye. The gallbladder channel sweeps across the side of the head, comes across the top of the trapezius, zigzags across the torso, moving slightly backwards at the buttocks, comes down the most lateral aspect of the leg and thigh, all the way down to the lateral aspect of the 4th toe. A deep pathway has connected with the liver channel, which starts on the lateral aspect of the big toe. The liver channel ascends between the 1st and 2nd metatarsals, comes at the medial aspect of leg and thigh, encircles the genitals, ascends the renmi for a small part, and then moves laterally to ascend 4 sun lateral to the anterior midline and terminate in the 6th intercostal space. From here the chi flows back up to lung 1.